The second project in this group is a study of a different but similar sounding receptor, the MC3R. And this is from Dr. Sweeney at University of Illinois. And the background to this is hypothalamic neurons express this protein, AGRP, and that's it's a protein that promotes hunger. And there's some evidence that it's overactive in PWS. And neurons that express AGRP also express MC3R, this receptor that's important in feeding behavior. And this receptor hasn't been studied for as long or as in much detail as MC4R, but Dr. Sweeney and his colleagues have recently shown that it has a very important role in regulating feeding behaviors. And they've got a drug that targets MC3R and inhibits feeding in typical animals. And what he's doing here is seeing how that information applies to PWS. So is this a pathway, since we know the AGRP neurons are overactive in PWS, is this a particularly good pathway to target for PWS? So he'll be testing how PWS affects the activity patterns of these neurons in mice and determining whether this inhibitor of MC3R reduces feeding in a PWS mouse model. So we're excited about this because obviously a drug target that is particularly effective in PWS would be great. The preliminary data is promising. It's a new pathway that might have relevance to PWS. And again, it's another new investigator, really good neurobiologist studying PWS for the first time. So the long-term goal of this project is to determine the mechanisms of altered AGRP neuron activity in PWS and provide the rationale or not of advancing MC3R antagonist compounds to clinical trials. And I think that's a really critical point with many of these projects. The goal here is to get a yes/no answer. Does this pathway make sense for PWS? Is it a better than, average, better than it is for obesity in the general population? Is it less effective than the general population? So just getting an idea of go, no go on some of these therapeutic avenues.